Hey, good afternoon, Scurry County. It's Dan Hicks, your county judge. I'm going to give you your daily briefing and let you know where we stand today. I'm going to give you the state of Texas first of all. We hadn't done that in a while, so I thought I'd go ahead and let you know where Texas stands. On the DSHS website, it shows a total of 989,994 people have been tested. Nearly 1 million people have been tested in the state of Texas. There's a total of 59,776 cases in the entire state, 1,601 fatalities. 230 of 254 counties have reported cases, and there's an estimated 19,270 active cases and estimated 38,905 recovered. So that's some interesting numbers to keep in mind as we go forward. In Scurry County, we've had a total of 38 results back today. 35 of those were negative and 3 were positive. So we now stand at 22 current cases in Scurry County. 2 are recovered, and we have a total of 24 total cases. So 22 current cases, 2 recovered, and the age range is from 1 to 70 on these cases. Total tested has been 705. There's 190 that are pending and 491 that are negative. So just so far, we have 515 results so far. Out of the 705, we have 515 results with 24 positives and 491 negatives. I did a little math just a minute ago. That's roughly 4.4% of those that were tested are positive. So if you look at it that way, we're doing pretty good. So there's something else I wanted to read to you. This is a statement that's going to be put out there, and this is something I completely agree with. Please remember that these are people, not numbers, the ones that tested positive. They are not our enemies, but our neighbors and friends. This can be a scary situation for them. This was not their choice. Some are becoming fearful of retaliation from their own community. Instead of outrage, anger, and calling for their personal information to be revealed, heed the recommendations of medical professionals to protect yourself and your family. This doesn't mean you have to stay home and avoid businesses or restaurants. Just be responsible and look out for others. Additionally, the Centers for Disease Control and Prevention estimates that more than 1/3 of COVID-19 patients can be asymptomatic. This means that even if you aren't feeling sick, you could have the virus and be unknowingly spreading it in the community. Therefore, we urge everyone to follow CDC recommendations for protecting yourself and your community. Social distancing, maintain at least 6 feet of distance from others. Wear a face covering that covers your nose and mouth in public where 6 feet of distance cannot always be achieved. Wash your hands, use hand sanitizer, and disinfect high touch areas frequently. Stay home if you're sick. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. If you develop these symptoms or come in close contact with someone who has COVID-19, contact your healthcare provider. And so the main thing that I would like to point to you in that statement is remember that these are our friends, these are our neighbors, these are members of our community who do have COVID-19, and we need to be mindful of that. Demands for information about them aren't going to do you or them or anybody any good. Doesn't help them. And besides that, it's against the law. We cannot provide names or addresses of these people. So I know there's been a lot of clamoring for that information, but you're not going to get it. We're not going to give it. We're not allowed to give it. If we do, we're just creating more of a problem and causing other problems as well. So keep that in mind as you go forward, and think about those families. And what if it was one of your family members that was dealing with this? How would you feel if they were being castigated by the public because they got something that they had absolutely no control over? So think about that. With that, I'm going to leave you alone. I will talk to you again tomorrow. Y'all have a great afternoon. Looks like it's a pretty nice day out there, and I think I'm going to get out there here shortly. Thank you.